This episode of Beauty and the Surgeon podcast is brought to you by Let's Get Checked. Let's Get Checked is an online company dedicated to making professional health testing easy and accessible. Let's Get Checked offers fast, affordable, completely confidential at-home health tests from a range of tests from STDs, male and female hormones, and even COVID-19. Listeners of our podcast who are new to Let's Get Checked get 20% off by using our URL, trylgc.com/beauty, and be sure to use the code BEAUTY20 at checkout. That's trylgc.com, trylgc.com/beauty, BEAUTY, and be sure to use the code BEAUTY20, BEAUTY20 at checkout. Do it. Getting tested is important. It's the responsible thing to do, and you know how important I think it is to make sure you understand your labs. Welcome, everyone, to Beauty and the Surgeon podcast. I'm Amy. I'm a nutritional therapy practitioner, and I'm joined today, as always, by Dr. Jason Martin. He's a board-certified plastic and reconstructive surgeon. Dr. Martin, how are you doing?
Doing pretty good today.
Good. Neil says you don't look stressed.
No, I'm not stressed. I'm excited to be here. So what's our topic today?
We have a good topic today. So we're talking all about the butt. It's a big topic these days. Butts are in.
Butts are totally in.
They have been for a while, which I think is actually a really good thing.
I mean, it started with Sir Mix-a-Lot, and then,
it's gone from there.
The late 80s.
I've actually been watching some episodes, some reruns of Supermarket Sweep recently.
Yeah.
And going back to the 90s, yes, these women, it was not about the butt.
It's about the butt now.
It is. And so we're going to talk about butt lifts, the ever popular BBL, and also we're going to talk about squats, my favorite topic.
Yeah, your favorite topic.
Sarah actually added that. I didn't put that in the title. She added that in. So how to make your butt look better.
Yeah, I mean, that's a good, this is a great topic. I mean, how to make your butt look beautiful.
Mm-hmm.
So, and we're going to go through all the options that you have mostly.
Yeah, pretty much. Yeah. So we always start off these podcasts, we usually start them off talking about the statistics from the previous year. And we actually do have the 2019 statistics. So
just came out.
They did. So butt augmentation with fat grafting is separated out from implants, and we're also going to talk about those separately. So the difference is kind of negligible for both of these things. There was not record keeping in the year 2000 for either of these, so we're really just looking at the year-to-year comparison. I was actually surprised to see that glute implants have actually gone up. So in 2019, there were 970. In 2018, there were 946.
Which is like a small amount.
3%.
Right.
It's a negligible difference.
So to put it in perspective, what is how many breast dogs were there? Like 200,000?
About 300, almost 300,000.
300,000. So yeah, I mean, it's not a lot of people.
It's not. And that's why I said even the fact that there was that many is kind of surprising. Butt augmentation with fat grafting, which is the BBL, which we'll talk about,
Brazilian butt lift,
up as well to around 28,000, whereas the year before it was right at around 24,000. So 17% difference. So not huge jumps, but they are still growing. Yeah.
And the butts are growing too at the same time.
They are, yes. So I think the main thing here is to talk about the difference between what we call a butt lift or glute lift and what is known as the Brazilian butt lift or the BBL. I think it's so funny. The first time someone said BBL to me, I'm like, what? Because there was this IPL device called BBL for a while.
I literally did the same thing. Yeah. And I was like, what is this, some strange IPL difference? Yeah. Because besides mommy makeover and plastic surgery, we don't technically call surgeries by some name like Brazilian butt lift.
Right, by a made up name.
Yeah. So we, a facelift is called a rhytidectomy. An ear pinning procedure is an otoplasty. So they're all Latin-based words. And then someone's like, yeah, have you been doing BBLs? This is another plastic surgeon. And I was like, what are they talking about?
Yeah, the IPL? No, we have a better IPL.
Yeah, I know. And so historically, it's been fat augmentation to the butt, right? Mm-hmm. So a BBL is really fat transfer to the butt. You take fat from one area and you put it in another. It just happens to be your butt. So that's what the Brazilian butt lift is. If you follow us on YouTube, which you should, Jason Martin, MD, you can see our slides. And actually the slide for this.
Actually, you cannot find them on YouTube. I mean, on Instagram. You find them on YouTube. Did you say YouTube?
I said YouTube.
I thought you said Instagram.
Oh,
he said YouTube.
It's YouTube. Working too long together.
It's YouTube.
Yeah, it's YouTube. Well, it is YouTube. But we're Jason Martin MD on Instagram too.
We are, but the slides aren't there.
All right, the slides that Sarah made, she used the Brazilian green, which I love. Okay,
Mm-hmm.
If you are a soccer fan, you'll recognize this green color.
Which is different than our green. Our green is darker.
Our green is So, and then the butt lift is basically surgical.
Well, we're going to talk about the differences.
Okay, perfect.
I have slides for that.
Perfect.
that are more interesting than this slide.
Great.
So let's first talk about what is a butt lift. Like, so when someone comes in and wants a butt lift, they're literally wanting to lift their glutes up. So they usually grab onto their butt and pull it up and say, can you do this?
Right.
How do we do that for them?
Right. So basically what they're talking about is a lower body lift on the backside. So body lifts lift the body. And we have
a podcast about
we have an
body
episode
lift,
on body lift. You should check that out. And it's circumferential. Usually it goes from the front to the back. And the lifting part literally lifts the skin and soft tissue that's there. People with massive weight loss, people with age, people that just genetically have more loose skin, they really notice it in their butt, right? And their hips. And a butt lift, the surgical butt lift can put an incision that follows the superior portion or the upper portion of your butt, the crease that goes down into, what is that area called? What does the layperson call that area? The sacrum.
Oh, well, the butt crack.
The butt crack. Thank you.
We're getting real classy on this episode.
The butt crack. What's the Latin term for that?
Oh, I'm sure there is one. We always called it the gluteal crease.
The gluteal crease, but okay. So it goes down into your butt crack, right? It follows the upper contour of your butt. And then you literally remove skin and soft tissue until you can lift the butt and soft tissue up. So you remove skin and soft tissue, which is fat, close it together. So that means you have a scar that goes over the top of your butt on both sides. That is a true butt lift in the terms of a surgical procedure.
Yeah. So on my slide here, I've got some things to know about a butt lift is that it's a long incision. Like Dr. Martin just described, this is an incisional surgery that is a long incision. I mean, if you think about it, you're lifting half of your body, the whole back half of your body up. Has a moderate recovery. It's not as involved as some other surgeries that we do without fat transfer. So if you're just doing that kind of back half of a body lift, that glute lift, it's not a super bad recovery. Like it's a long incision, but not all that terrible. Alone, a butt lift will improve the perkiness of the glutes, but not the size. So it'll move the glute you have. It'll pull that skin and soft tissue, like Dr. Martin described, back up.
So it'll take your white lady butt and move it back up to
make it
normal
higher.
lady butt.
Yep, but it's still white lady butt.
But it won't give you Kim Kardashian butt.
No, it will not.
Won't give you the Kardashian.
But combined with fat transfer or liposuction, you can then improve the shape, size, and the perkiness. So a lot of people have saddlebags, and that can really distract from the shape of the butt. Like it makes your butt look really like pear-shaped and wide. So sometimes if you do a lift, you still need to get rid of that fat that's kind of sticking out the sides that gives you that really pear shape. Liposuction there, even like on the flanks to really kind of help bring your waist in.
Yeah,
like
your upper hips. Yep.
Those things in combination can actually kind of trick the eye and give the appearance of a larger butt without actually having to do a fat transfer or having to do something more involved. So it's a great surgery. We don't do a ton, and neither does anyone in the United States, as you can see on those statistics. 300,000 breast augmentations, less than 30,000 glute lifts. So it is not a lot of people. And a lot of people, though, that have kind of the butt lift are probably having a body lift, which is also, I mean, if we go back, what were the body lift statistics? Are they even on here?
Yeah, they are. Right.
Oh, it's...
Yeah. Lower. It should be a lower body lift.
Oh, because lower body lift. Yeah. I mean, not even 9,000.
Yeah.
8,700.
And the butt lift was what? The buttock lift is about 4,000. Yeah.
Yeah, butt lift was 4,000.
Yeah. So just think about when you do a tummy tuck that tightens the front, you can also lift the front of your thighs with a body lift, and you just carry that around, that same incision to your back that goes over the top of your butt into your butt crack. I can use that word. I'm allowed to in this episode. And unless we'll be censored by YouTube. I don't know. So it goes around to your butt crack, and that's basically an extension of your tummy tuck scar, and that's what it does. And you can just do that in an isolated fashion. So we talked to a patient today who had that done.
Had a body lift.
Had a body lift that went around to the back and lifted her butt. Actually, yesterday I was looking through my postoperative pictures. I saw a patient that we had done this on, and it was a tummy tuck, and I carried it all the way around past the hips, the top of the butt, and brought it down. It made a huge difference on her butt. And as Amy was talking about, I also did liposuction on her saddlebags and really brought that in. So it really transformed her butt.
It makes a big difference.
But it's not going to give the volume that a lot of people want now.
No, the volume or the shape. And that's what I mean. Like just that by itself isn't going to, it's not going to suddenly build muscle that you don't have. And the muscles of the glutes are really what give it the shape.
Yeah.
The muscles and the fat, but primarily the muscles. So just lifting that soft tissue back up, if you don't have good muscle tone underneath it, you're still just going to have the same butt, just higher.
Yeah. And most people, when you lift it up, when you actually do the butt lift, the area you notice the least amount of volume is actually at the top because that's where all the tension is. So that's where you would put the fat grafting in the upper third of the butt. So when you combine it with the butt lift.
Yeah. Well, so let's talk about just the BBL. So a couple of things about BBL. Little incisions, tiny, right? Because all you're doing is liposuction and fat transfer. Has a moderate to long recovery, bordering on the long recovery.
Yeah, why is that?
We'll talk more about that.
Okay.
But it can improve the size and the shape, but doesn't really do anything to address the lift or the perkiness. Now, volume will lift some, but it's really not lifting.
Right. So it would be analogous if you think about breast. That's where people always get confused. They think if you do a breast augmentation, it lifts your breasts, but you're adding your weight to a saggy sack. That is really terrible to say to women listening to this. So you're adding weight to something that has laxity to it. So it's the same thing with the butt, right? Just because you put fat in there doesn't mean it's going to lift it.
It's not going to lift it.
A lot of women these days who are getting BBLs are just culturally deficient in the butt, right? So some people with Latino backgrounds, stuff like that, they want more contour, but they don't have saggy butts. Saggy butts usually comes with age. If you have a Caucasian background,
or weight loss,
or weight loss, and so a lot of people getting BBLs aren't those kind of middle-aged or post-weight loss patients. They're younger and they just want more contour.
Yeah,
and it makes sense, right? Because if you have a little bit of fat on your hips or your belly, then you could transfer that fat to your butt and really change the contour and make it wonderful. And their skin integrity in most of those cases is probably decent.
Well, let's talk about in like a little more detail about what fat transfer to the glutes really looks like. So what are the steps that are involved?
All right, so with any fat transfer procedure, you have to harvest the fat, and that means liposuction. There's a certain technique to harvesting the fat and to caring for the fat. We use a transfer system that washes the fat and prepares it for re-injection.
Yeah, and the volume of fat that's necessary to make a notable difference, I think, is what is surprising to most people, because you could inject even probably 1 to 200 cc's of fat in somebody's glutes, and you're not really going to see any difference at all.
Yeah, I can see anything at all.
Because of a couple of things, like that's spread out over a large surface area, and not all that fat that you inject is going to take. And we've talked about that before when we talked about fat transfer. Like it doesn't all take.
We have an episode on fat transfer where we actually talk about it. There was there was a question from one of our listeners.
It was in a frequently asked question.
Yeah, and she asked like, how do you prepare the fat? What do you use? Which I thought was an amazing question. And there's so many different kind of techniques to prepare the fat.
Yep.
So
treat it very nicely.
Yeah.
Yeah. But you need a pretty significant volume. So a person who comes in very often who wants a fat transfer to the glutes is also very thin. And we could liposuction their entire body and probably still not have enough actual usable fat to make a notable difference.
It's the irony, right?
Yes.
So skinny people don't have big contoured butts.
Right.
But they're the ones that want it.
But they don't have the fat.
And then it makes you wonder when you see that person, you see that person out in public and they're super skinny and they have this really contoured butt. A lot of that has to be muscle underneath or an implant, not fat, because there's no way that in most cases, you could have gotten enough fat to really make that much of a difference, or maybe genetically they're just shaped that way.
They might be genetically shaped that way, but it is a unique person who has a combination of a very deficient backside and enough fat to really successfully transfer it. And we've had a few patients come in for consults with us who have been told by other doctors that they just need to gain weight before surgery. Well, that's not going to work, because as soon as you lose that weight after surgery, all the fat that you just injected into your butt is going to go away.
What?
Like fat is fat.
Is anyone listening? Does that make sense to anybody?
No.
Okay, wait. Gain weight, re-inject the fat, and then lose weight because you're going to naturally go back to whatever your standard weight is.
Yeah.
And then the fat you re-injected is going to get smaller.
Yes.
I mean, you'll still have extra fat there. It'll work, but it won't work as well.
It won't work as well. I mean, that's why I say to people, like, don't ever be at a weight prior to surgery that you don't want to maintain after surgery, like on purpose, because you're working against yourself from many standpoints. And we've talked a lot about how fat functions hormonally in the body and other reasons. Like, there's no reason to gain weight for a procedure unless you are underweight and your doctor tells you have to gain weight or you can't have surgery because you're too skinny.
Yeah.
But something else I didn't put on my little list here of things that you need to think about along with the long recovery is that there's a high likelihood for revisions with this procedure, as there are with any bilateral fat transfer procedure or any unilateral fat transfer procedure, because fat doesn't all take or doesn't take evenly. Like, you can inject the same amount of fat in both sides. You might have more take in one side. Perhaps during that long recovery period, the person sits on one side more than the other.
Oh, yeah.
And the fat there doesn't take as well.
I mean, that's something we have to talk about. So anyways, you harvest the fat, liposuction, you wash the fat. What is the system I use? It's
we talked about this last time too.
Oh, yeah. I'll remember it before the episode's over. It basically puts it through almost like a dialysis
kind of
weave
filters it
out.
Yep.
And then you get the little fat globules that come out are just the perfect size for re-injection. And that's a closed system. It stays sterile. It goes back into injection cannulas or syringes, and then you put cannulas on, you re-inject through small little stab incisions. And that's the whole idea. You can theoretically inject it in all parts of the buttocks, but we'll talk about the dangers associated with BBL, which are real. And were addressed specifically by our National Society in 2018. It was a big deal. It was in the press and all the national papers and stuff. But yeah, you can inject it throughout the butt. You do it in a layered fashion, usually deeper to superficial, and you do it in what I call a micro injection fashion. So just little bitty amounts on each layer. Fat has to use the surrounding blood supply to live, and if you just inject tons of fat in there, the fat won't be able to get blood supply to live after the injection. The data shows, and this is real, that only 60 to 70% of that fat's going to make it. Best case scenario.
Yeah, even when you treat it really nicely.
Yeah. So people have a tendency to over-inject, which is also a problem. We'll get to that in terms of safety. And why are they over-injecting? Because they know they're going to at least lose 30%. And they may not tell you that, but that's the truth. Okay, that's in the data. That's real. So they're going to over-inject. And so afterwards, if you love exactly how you look right after surgery, you're not going to look like that in the future.
Yep. 3 months down the road, you're going to be sad.
Also, when you're doing a transplant, like injecting fat from one place to another, that fat does not like areas without oxygen, right? So that's why you need it near a blood supply. You can't over-inject it. You have to do real thin layers over and over and over. And then also, it doesn't like pressure. Pressure is not good for grafts, because pressure compresses the arterioles, the small little blood vessels that are there, and the oxygenated blood can't get to the fat graft. Is this getting too sciencey?
No, I think this is perfect.
It's okay. Yep. Are you okay, Nils?
Yep. We're on target.
So where does pressure come from? Well, there's not an elephant sitting on your butt, but you can sit. And when you sit, that can cause problems for your fat graft.
Or lean or lay.
Yeah. Or if you sleep.
Yep.
And so it's kind of troublesome. Like you cannot sit or really lie supine or on your back for what we say is 4 weeks at least, and up to 6 weeks. And that could be really hard.
Well, because that includes things like driving, like sitting in a car to drive. Like that is definitely putting direct pressure on your glutes.
You want to have funny conversations, talk to patients how they get around.
Yep.
Having someone drive them
in the back of the car.
Yeah, exactly. We had a patient literally on all fours. I was like, how did you seatbelt in? She goes, my fat graft was more important than my body.
She was in like a gigantic Escalade. She could have figured it out somehow, how to seatbelt herself into this back seat.
And if you go to an office that does this a lot, they'll have a whole system in place. If they tell you it's okay, you can just sit on your fat graft right afterwards. I totally disagree with that. Now, obviously, this is an art form. People have different methods the way they do it, even though I know I'm right when I say that. But I think you just need to be very careful with the graft afterwards. And that's it. I mean, it's a decent amount of recovery. The recovery is not maybe super painful. The liposuction can be, but the injection part is not.
No, it's just sore.
But you're sore. But then afterwards, it's kind of difficult because of manipulation and positioning of your body.
Yeah, just being really careful on how you treat that fat. And even best case scenario, you follow every single instruction your doctor gives you, you still might have an uneven result in the end. So knowing that going in, and any office that does this regularly should tell you that, like it's likely that you will need a touch up or some adjustment of the fat side to side when you're doing fat.
I don't think likely is the right assessment, but I think that you need to go in thinking that that's a possibility, a real possibility.
Yeah, you should go in thinking that that's likely the case. And then if it isn't, great.
Yeah. Because I think that most asymmetries are really negligible. But the problem is that the surgeons like me are completely OCD and they want it perfect. And then also the patients who want these BBLs tend to be very body conscious.
Well, and you tend to spend a lot of time looking at it after.
Right. They're more likely to take pictures of I mean, these are the types of patients that are doing this. And, great.
You're looking.
Yeah. And they're very much looking at it. So you just want it, to be perfect. And that's what it should be. These things, can cost a decent amount of money. You should expect for that to be perfect. A touch-up procedure you can do in the office with a little local anesthesia, and it shouldn't be that bad. Yeah.
The primary surgery, though, like Dr. Martin explained, there's, you really want to make sure that this fat is treated extremely carefully and in a very sterile environment to avoid infection. So typically, these are things that we would do in the hospital, like in the OR.
Yeah.
Now, there are a lot of doctors who might do this in their office, but again, the amount of volume of liposuction that you need to do for most people may be a challenge to do with someone awake. To get enough fat, then they have to, you'd be laying there awake, waiting for the fat. Like it's a better procedure to be asleep for sure.
Yeah. And, historically,
and for positioning,
when we were injecting more into the muscle before the data came out about the risks associated with a BBL.
It hurts.
It would be hard to do that with you awake. Now that they recommend really not going into the muscle, and we'll get to that. You could probably do it in the office awake, I think, better. And also they're recommending only, certain things like staying in the upper third of the buttocks. We've done that in the office under local anesthesia. It's totally doable. But the type of BBL that most people are thinking of and want, that full butt injection area, staying away from the super, problematic areas, I think you need to be asleep for that.
Yeah. Yep. Yeah, it is. It's just one of those that you're going to probably get a much more satisfactory result if you can really let your surgeon be focused on the surgery and not your comfort and a lot of other things that are distracting when you're awake. So let's talk about, there is a special consideration that you've mentioned a few times about BBL specifically. I'll let you kind of discuss what that is.
Oh, you can go through it. Yeah. I mean, it's from Janice. Janice is, I think he's in Texas. He was the ASPS president. It's a small group of us. We all know everybody. But anyways, they released, I think, was it 2017?
It was in 2018, but it was because of the statistics from 2017.
Yeah. And it was basically, it was unprecedented. They don't really do this very often in plastic surgery. I think they probably did it recently with the implant recalls. And we have a great episode on that about ALCL. But he came out, or the society, our national society came out and said, hey, we need to really look at this procedure, buttocks augmentation, which is really what we called this historically, with fat transfer, has a higher incidence of serious complications, including death.
Yeah, and that's what he said, that they were concerned with the high mortality, death rate,
very specific,
of this operation, and is aggressively investigating ways to make this procedure safer. This new warning emphasizes the continued risk that is being encountered with this procedure. So the incidence, what they found in looking at all the data, was 1 in 3,000. So that may not seem like a lot, right? That's pretty high.
That's really, really high in comparison to other surgeries. It was like 100 times, I hope I'm doing the math correct here, like 100 times more serious than other surgeries that you could compare it with. So you're 100 times more likely to die with this buttocks augmentation with fat than just with regular surgery and cosmetic surgery. Now, clearly, for elective procedures,
that's kind of that's a pretty high risk.
We're not in the business of having people die.
Yeah.
Like, this is not some traumatic TV show where surgeons, trying to save lives. These are elective procedures, and you're healthy and you're listening to this and you want the surgery, and that's really serious. So we had to do a lot of internal inspection about what our techniques were, what we were doing. They did a lot of research. There's a lot of research articles after this that came out showing the anatomy of the buttocks, which we're not going to go through today, which is extremely complicated and super boring. But it has a lot of blood supply there for obvious reasons. There's really big muscles, and muscles need a lot of blood supply and oxygen to work. And they found what they thought was going on, which basically is when you inject fat into those areas, especially deep and in certain areas, the incidence of injecting that fat directly into a blood vessel was higher than most other places in your body. Once the fat gets in your blood vessels, and especially in the venous system, what happens is it can go back to your lungs and cause a pulmonary embolus. That's called a fat emboli. It's extremely serious. That's a really, really bad problem. That's worse than having a blood clot in your lungs. A fat emboli is even worse. And the incidence of mortality is very high. People get very sick. And, by and large, people that do BBLs are younger.
Yeah.
And so here you have this surgery that has when I say high mortality rate, it's still very rare, but, concerning comparison to other surgeries, primarily with young women. Okay. And it was alarming. And they released this, and this got picked up by all the newspapers.
It did. And I think
news outlets.
Yeah. And a really key factor that they state in here is that complications from surgery are likely a result of numerous factors, including the technically challenging nature of the surgery, and that the rise in interest has caused more, and this is the really important part of this, non-board certified and non-plastic surgeons to perform the operation.
Right. Because here's why. Liposuction, I do it all the time. I think it's an art form. A lot of people don't look at it that way. So a lot of people that are not plastic surgeons or even, trained in liposuction do it. Secondly, taking that fat and washing it through a system is not very complicated. You just got to get the right system. Putting it back into a syringe is not very complicated. Putting a cannula on that syringe and injecting it back into some area, if you don't know what you're doing, you could just do it.
Right.
It's not like doing a face or neck lift, So the problem is that the technique involved with a butt augmentation with fat is extremely important. And if you veer off the path, you can inject this fat right into a blood vessel and literally kill the patient. So that was the problem. But BBLs, because of cultural shifts, were becoming way more desirable. And then in anything in aesthetics, when people realize you can make money there, everyone starts doing it. And I'm saying that with peace and love. I'm not trying to be mean, but that's the way it goes.
Yeah.
So, and that's what happened. More board certified plastic surgeons, and we're not like trying to get on our soapbox here, but in reality, they weren't trained. They were doing this, and they were having bad outcomes. And some board certified plastic surgeons had bad outcomes too.
Absolutely, and that's the final kind of thought here from ASPS was that patient safety is always our top concern. So we encourage all surgeons and potential patients to talk in depth about the significant risks associated with gluteal fat grafting before considering a BBL. So, it seems great. You take fat from one area and inject it in another and, run through a field of daisies blissfully with your large butt now. That there is a significant risk with this specific type of fat transfer.
Right. But that risk can be mitigated. You go to an office that does this all the time. That's the key important thing. You talk to them, you ask them actual questions. And the problem is a lot of the people that do BBLs tend to be younger. Younger people are more impulsive. I was there at one point in my life. I get it. I'm not criticizing. And you get swept up in this idea that you're going to have this beautiful butt. Well, stop for a second and just take a step back. Make sure the person you're going to is board certified. Make sure they do a lot of these, and you're going to be okay, right? But you have to ask those difficult questions. The second thing they found is injecting it in certain areas. Everybody wants the lower butt. That's a really bad area to inject it. That's where a lot of the blood vessels are. The upper third of your butt is the safe zone. So if you're looking at your butt and you want a BBL, just remember a majority of that change is going to be on the upper butt.
Yep. Well, should be safely.
Should be.
Yeah. Yeah.
I mean, did we beat that horse a little bit?
I think we did.
Did we beat that butt?
So now we're going to take a quick break to get a word from our sponsor. Dr. Martin, I'm super excited to talk about our sponsor for this podcast, Let's Get Checked. If you've been a listener of our podcast, you know that we have never had a sponsor before, and that's because we're an educational podcast. We're not looking to monetize, and we also would never recommend something that we didn't believe in and or use ourselves.
So basically you're saying we're very choosy.
We're very choosy when we come to our testing, but Let's Get Checked really aligns with our values. We talk a lot about monitoring your blood values of certain things. We talked recently about vitamin D serum levels. We talk a lot about hormone levels, and it's hard for some people to get to a lab, or you're afraid of the blood draw, or just, you're concerned about confidentiality. Like you have a lot of concerns and you just don't do it. Let's Get Checked makes it super easy because it's completely confidential. You do it from your home. So there's really no excuse not to do it.
Yeah, and we did it recently. Both Amy and I did it. She looked at her women's health, basically her hormone levels, and I looked at mine on the men's health side with testosterone. It was very simple. You go online. Their online interface is really easy to use and good. We got the testing kit very quickly, and the test itself, actually doing the stick, you do a stick on the end of your finger, is not hard to do. It only took about 3 to 4 minutes. You put it back in a sealed envelope that's confidential, goes back to them. You get your results in 2 to 5 days. It's really that simple. And the best part is it's about empowerment, about you taking control and trying to do things that are positive for your health and life. And this is one way to do it, literally from the comfort of your own home.
Yeah, so they offer a wide range of tests. So they do men's and women's hormone panels. They do a full panel of STD testing. They also are now offering a COVID-19 test at home. So there are a lot of other just basic blood levels that you can get tested as well. And one of the things that we always say is you can't track what you don't check. So you might not know what's normal for you in the future if you're not checking it now, especially as it relates to hormones. And men's health specifically, I feel like is a little bit undertreated. I mean, sperm counts are dropping by a large percentage in men these days. Most men struggle at some point in their lifetime with low testosterone.
And those men do not know what the symptoms of low testosterone are. Depression, anxiety, sleep problems, osteopenia or loss of bone, loss of muscle, and something we treat all the time, gynecomastia or male breast growth. These are real problems that can be improved or treated with testosterone. And these men do not know their levels. It's so easy to get checked. And this is why we're so excited about the sponsor.
Yeah. And Let's Get Checked is a completely CLIA certified lab, the CLIA lab. So they're a well-established, completely safe lab to use. You do get contacted after, so you get your results. I got a text at 4:30 in the morning, which I loved, that my results were ready.
And we're both up at 4:30, so that was good.
Super excited. And you have access to not only a nurse, but also a physician. So a physician does review your results, and it gives you a little breakdown of like where you're sitting on those levels. Dr. Martin's had even comparisons of like where 2 of the levels should be in relation to each other, which is a really important thing to note.
Right.
Just being within the normal range is not always enough. So it really gave more information than that. implant. You'd still want to, of course, reach out to your own doctor if you needed some additional assistance with these labs or you did see something that was concerning. We didn't, thankfully, so that was good.
Yeah. We were both good. This podcast is about empowerment. It's educational. In my private practice, I'm a board certified plastic surgeon. We are all about empowerment, and this is one way to do it. So we're very excited about the sponsorship, and we're looking forward to using it for our patients moving forward.
Yeah. So as a listener of our podcast, if you're also a new time user to Let's Get Checked, which a lot of you probably are, we do have a 20% discount code. So you do need to go to our specific URL, and it is linked in the description box below, but it's going to be TryLGC, so TRYLGC, like Let's Get Checked.com/beauty, BEAUTY. And you'll need to use the code BEAUTY20 at checkout. Beauty again is BEAUTY 220. And you can pick a test, like any test you'd like, put in our code and get your test shipped to you. Getting tested is the right thing to do. It's lets you know where you're at and what's responsible.
All right. Well, let's get tested.
Let's get tested. Let's get checked.
Let's get checked.
All right, so let's talk now about the third option for like the surgical enhancement of the glutes. We'll call it surgical enhancement. Silicone implants.
This is like not a common procedure.
970 in 2019.
When I went through training, I didn't even see one of these cases. Now, I trained in Chicago. If I would have trained in maybe LA or Miami, it would have been more common, but it's just not common. And the problem is the extrusion of the implant. It's a area that commonly gets infected, and the implants can kind of extrude out or kind of work their way out. Because of the pressure that's there.
So there's a few things about silicone implants on the glutes. It's a smallish incision, kind of like a breast implant. It's not a super long incision. There are high incidence of complications, may require additional surgery in the future. And by that, I mean not only surgery to remove these implants in the future, but also additional surgery to address the skin laxity that may have result from having an implant in. Just like we see with women who get their breast implants out, they may need a lift.
And just like with breast implants, you can get scar tissue around it. Mm-hmm. It hardens. Capsule. Yeah, and since that's the area where you sit or near where you sit, it's not on your sits bone, but it's near there. That could be uncomfortable.
Yeah. So much like a breast augmentation above the muscle is how a glute implant is placed. It's above the muscle only. The glute muscles are extremely strong, and there'd be no way of putting an implant underneath them like there is with a breast implant where we typically go under the muscle. So because of that, there are some issues there. It's can be visible. Like you can palpate the implant pretty easily, especially if somebody's very thin. You can probably YouTube this and see videos of people flipping their glute implants.
Are you kidding me?
With their muscle. Yeah, they'll flex their glutes and it'll flip the implant.
Oh my God.
Yeah. So, somewhat like a breast implant.
This is like personal information, but if you were like happened to have an intimate relationship with someone, but you didn't know they had
glute implants,
and then they were coming out of the shower and they flipped would that just kind of freak you out?
Right, and now their butt's flat on one side and round on the other because the back side of the implant is flat. Yeah. I mean, that would be really weird.
That would be really weird.
Yep. So, the ability to palpate the implant is definitely there. You do see glute implants in bodybuilding competitors, like people who just really have a difficult time.
I mean, the same person that would do a calf implant would do a glute implant, or, as a kind of pec implants and stuff like that.
Yeah. So someone who does not have additional fat to transfer.
This is definitely, if you're going to do one of these surgeries, you definitely need to find the person that does these on a regular basis. Like in our office, we don't. And that's not because we're not capable of doing it. I've chosen not to do it just because of the higher complication rate associated with it.
Well, it's not. When was the last time somebody came in and asked us for a glute implant?
Yeah, but you could educate people and say, hey, this is a possibility. But I just don't think it's appropriate because of the high complication rate. With that said, there's other surgeons that do this and they probably have really good outcomes. So you're going to have to look, but seek out and find that person.
Yeah. And of the 970 people in this country who had one last year,
what if it was like three surgeons?
There might be. That's what I say. There could be.
And they're in some weird place like Idaho.
Just a handful of doctors even doing this. But, you do have a small incision. It's well hidden under the gluteal fold.
Yeah.
It's a well hidden incision. There used to be theory that like the incidence of complications, like severe complications like extrusion and like these other massive complications were really, really high, like 30 to 40% higher than like breast augmentation. Through additional kind of like breakdown of the data, they found that it's maybe not that high, but it is still definitely far higher than other types than like breast implants sure.
I think to lay this out, just like the mortality rate with BBL, the complication rate here is not astronomical. If it was, they would outlaw the procedure, right? It's just higher than our normal complication rate. And, when you have a surgical practice, you make decisions. You say, I'm either going to do this or not do that. So I'm someone that does a lot of things, but this is one of the ones that didn't make the cut.
Yeah.
Sorry.
Right. So one other thing that I didn't put on this slide because I haven't seen the evidence that this is true, but we did have a patient tell us that there was, and I did do some research on this back like 2 year and a half ago. We were really learning more about BIA-ALCL, that there was a confirmed case with glute implants because the glute implants are that same very highly textured.
Yeah.
So the patient came in and said that, and I did find some anecdotal kind of studies in that, or articles in that time, that they thought that there were some potential cases of ALCL from glute implants. But honestly, I have not followed up on it again because it's not a procedure that we do. So it's kind of outside my,
Yeah, we've had a few patients who have had implants all of them, I think, before they came in, had them taken out.
Yeah.
Yeah.
So
okay.
Yeah, but it is.
So it's kind of
an option.
Like it feels like we're negative here because if you're going to do something for your butt, you either have to have an incision that goes all the way to your butt crack, you have to accept a higher mortality rate, or you have to accept the fact that you have higher complications in extrusion of an implant. I mean, this is kind of bumming me out.
Well, there is another option.
Okay, good. What is that other option, Amy?
So the other option is our non-surgical option. And this is probably the best option. And
this is BS. This takes work.
This option,
we don't want to work. We want instant gratification.
This option should be completely exhausted before you even consider surgery, unless you have had like massive weight loss, you have a condition of your skin that causes it to have laxity, like Ehlers-Danlos.
Yeah.
If you don't have other options, you should look into surgery. But
there are people, and there's definitely going to be people listening to this podcast who are like, oh, if I'll just do the squats, right? Because a lot of people don't want to pay the money for surgery, and we totally get that. You don't want scars or pain or downtime. There are certain people out there, it doesn't matter how many squats you do, whatever you do, you're still going to have loose skin. And that's from weight loss, pregnancy, your genetics, diseases that you've had in the past. Even people have had chemotherapy, right? Their skin changes after from breast cancer. The collagen in your skin. Yeah. So on those patients, you're probably going to have the true butt lift if you care. And that's okay. You still want to strengthen that base foundation. Sorry, keep going.
Yeah. So the couple of non-surgical options are my favorite, which is to squat. Yeah. Like you got to squat, ladies and gents. There's a great book if you're wanting to kind of learn more about bodybuilding for women and how to build your glutes specifically, a book called Strong Curves by Brett Contreras. It's an awesome book.
You got to follow him on Instagram.
Yep. So that's,
like his whole stories is like very teeny tiny women doing huge hip thrusts with like some enormous amount of pounds. You remember we made the joke that Amy was going to hip thrust a Volkswagen Beetle? Mm-hmm. Yeah. Like it's like that. I think you could.
I could. They're not that heavy. Yeah. I mean, with the right leverage, I think I could do it. So Brett Contreras, follow him on Instagram. He's Brett Contreras and then the number 1. I don't know why, but he's known as the glute guy. And
he has the glute lab in like Southern California. I think that's his place.
He has his own gym now. He also has another book that's a little bit more advanced that came out within the last 2 years about muscle building, but I would highly recommend if you're starting out, definitely start with Strong Curves. It's really cool because he's one of the only people in the industry really who's done actual real scientific, he has a PhD, has actually done scientific studies on glute activation and glute growth. And it's really interesting.
He's very intelligent. To hear him talk about the glutes, like he's all up in it.
Yeah.
Okay. Again, that's another double entendre. But he really is, and he's really intelligent, and I think he has real good information. I do think I think you and I both agree that no matter what you do, integrating strength training for your buttocks area is enormously beneficial to the appearance of your butt. First, okay, that's baseline. Second thing, and I can tell you this from personal experience, strengthening your butt for all those people that have lower back discomfort and problems like that is huge because that glute activation is a big part of that whole chain of muscles, which Amy can talk about at length. And a lot of people, me included, even though I'm doing a lot of standing work and I'm active, don't activate their glutes for just standing and even sitting.
Or even squatting. People don't know how to activate their glutes when they squat. They're just using all quad. Which
is when you listen to someone like Brett Contreras, who's like a true expert in basically butt muscular anatomy in this area, he really talks about that. Really isolating the different muscle groups can be very difficult to do, and that mind-body connection.
Yeah, and there's on the slide here, there is one of his recent Instagram posts, again, at Brett Contreras 1, that talks about targeting the different glute regions. And we kind of touched on it earlier that the glutes are complicated, but there are 3 main muscles that make up your butt. There's the gluteus maximus, medius, and minimus. Do you know which of those 3, Dr. Martin, allows us to have upright mobility, allows us to walk in a straight line?
So I would say maximus because that seems like it's the biggest, but then I think it's a trick question. So I would go minimus, but then I'm going to go the middle one.
It is the medius. It's the glute medius. Yep. That allows us, without that, we would literally walk.
That's how I made it through med school.
We'd twist with every walk. So we would twist side to side.
Give me any test. I will give you the right answer.
Yeah. So we wouldn't be able to walk in a straight line. So the glute medius is really what allows us to keep our hips rotated externally and allows us to walk straight instead of doing a weird twisty walk with every step. The maximus would just pull us side to side essentially as we walked.
It's super strong muscles.
Really strong muscles, which is why you can't put an implant underneath them. Like you couldn't get underneath them.
And from my plastic surgery training and reconstruction, there's a lot of really important blood vessels and nerves that come out at the bottom of the butt that control big parts of your lower extremities.
Yeah.
Because you think about your spinal column comes out at the sacrum or the bottom of your back and then branch out, go underneath the butt muscles and then get into the leg and control that area. That's sensory and motor.
It is. And they go through some of the muscles like deeper in the hip girdle, essentially like your deep six hip rotators, your piriformis. A lot of people have probably heard of like sciatica, obviously, but there's also something called piriformis syndrome where the sciatic nerve gets actually impinged.
Yep.
It can actually, genetically, you can have a sciatic nerve that bifurcates the piriformis, which is really bad because then you always kind of have piriformis issues with your sciatic nerve being kind of impinged. There's a lot of musculature that's even deeper than these main glute muscles that are really key. And like Dr. Martin said, there's a lot of stuff, nerves, big blood vessels that are running through all this area.
I hope Brett Contreras doesn't watch this because we're like saying there's a lot of stuff that runs through there. We can name all of them, Brett.
We can.
I
can tell you what the deep
but
six are.
We're not gonna bore our audience.
The Gemelli
here.
brothers. Yeah. I got all the deep six. So there's the cool thing about this slide, though, is it talks about, and in his post about this, talking about the different ways to work the glutes and for different people. And it's really interesting to follow him because he does case studies still with groups of a lot of women and men too, that shows that not every exercise works for everyone in the same way. So what really activates your glutes, and that's why it's really important to understand how to appropriately activate your glutes. And that's why strong curves is really key. Because you can be squatting like 200 pounds and still not really be activating your glutes. You can be hip thrusting and not really activating your glutes because of the way you're hinging, because of the rotation of your pelvis. Maybe you need to do lunges. Maybe you need to do split squats.
So yeah, the split squats or split leg squats, I started doing that before my squats just to get kind of that activation going
on each side.
And it made a huge difference in my squats.
Right, warms them up.
It warms it up, and you kind of were in that mind muscle connection, and so you're really isolating that one side and then the other, and those are hard to do, by the way.
They are. They're so hard.
Even body weight without weights.
Falling over.
I know. And you have a balance component of that too, and that really made a big difference. So I think really focusing in, if you are concerned about your contour of your butt, you have to really also focus on the foundation. It doesn't matter if you get fat transfer. It doesn't matter if you need a lift for saggy skin, or even if you're going to get an implant, that you have to focus on this foundation. And if you do that, your outcome from cosmetic surgery will be a lot better, for sure.
Yeah, absolutely. And specifically then maybe you can avoid some plastic surgery. Like maybe then we can just lipo your saddlebags and your flanks and you don't need anything else done on your butt that's incisional or would take a longer recovery than that. Something else that's really key with building muscle in general is just to make sure that you're getting enough quality protein, like increasing your intake of high quality protein to at least 0.8 to 1 gram per pound of body weight is going to be really key, because you can be doing all these exercises, and the tendency for women specifically, but for men too, is to undereat when you're working out because you think you're somehow helping yourself by doing that. You're not. You're actually making it harder for your body to do everything, including build muscle. You're lowering your immunity. You're doing a lot of negative. So making sure, like when you start to work on building your glutes, that you're also looking at your diet and making sure you're getting enough protein. Yeah,
and protein's harder to metabolize. There's the thermic effect of food, which we've talked about before. It takes more energy to metabolize the protein. So you're burning calories if you eat protein. Just look at it that way. And you need protein. Protein's the building block for muscle.
And for skin.
Yeah.
Healthy
and
skin.
Every female patient's like, I can't bulk up, or I don't want to bulk up. And we're like, yeah, you do. On your butt.
Well, and good luck with that.
Yeah,
like
exactly.
you don't have enough testosterone to
I don't
bulk.
even want to go down that
you really
rabbit
don't.
hole. I mean, it just makes me so
you
frustrated.
I
feel like we need to have like a skyrider go over, in an airplane.
Yeah.
Like,
good luck bulking up.
Yeah.
Ladies.
Good luck,
yeah.
ladies.
Yeah.
Good luck. And so you need the protein. You need to focus in on your nutrition. Diet and exercise is extremely important. Muscle tone is the basis of good outcomes for cosmetic surgery. If you tighten the skin and remove fat, then you hope you have stuff underneath that looks good, that really gives you the best outcome.
Yeah. Well, I think we've done justice to the butt.
Yeah.
Can I tell one funny story about the gluteal crease?
Sure.
So when I was in massage school, we had I can't remember his name right now.
Is this like an X-rated?
No, he was this little Asian guy.
Yeah.
Massage is not X-rated. I'm a therapeutic massage therapist.
Yeah.
What was his? It doesn't matter what his name was, but we were doing protocols in sports massage, like specifically for the like deep six for the hip rotators, and he said the crack is not a handle. And every time I'm really working somebody's glutes, I think that in my mind, because like you do like the natural tendency, like if you're working with your thumbs toward the midline like this, right? Like you want to hold on like to the, don't do it. It's not a handle.
Don't handle the crack.
No, nope. All right. Well, thanks everyone for listening today. If you made it this far, I hope you appreciate my funny story that was not X-rated.
I hope that the teacher, the small Asian man that taught you, would be laughing. That
he had a very American name.
Okay.
Anyway, so if you are interested in watching the slides from this video, you can watch those on YouTube.
Yep. Jason Martin, MD.
And you can also find us on Instagram at Beauty and the Surgeon Podcast.
And at Jason Martin, MD also.
Yeah.
And we don't want to dissuade people from BBL. We know this is a really kind of popular and common procedure, but this podcast is about education and empowerment. And so you really need to look at the data yourself and find a board certified plastic surgeon that does this procedure. If our national society is releasing, a pretty scathing and straightforward, what would you call that? Press release. Then you know this is really serious. And that does not go away. Just because that was in 2018, this is 2020, doesn't mean that the same risks don't exist. They do. But you have to go to someone who knows what they're doing. They can't inject in the lower third of the buttocks, and they cannot inject into the muscle. And those are the three main things. So please do your homework and be safe.
Yeah, don't group on your BBL.
Yeah.
All right. Thanks, everyone.
See ya.
Don't forget to check out our sponsor, Let's Get Checked. Let's Get Checked offers fast, affordable, and completely confidential health testing for everything from STDs, male and female hormones, and even COVID-19, right from the comfort of your own home. And remember, new customers and listeners of our podcast get 20% off by using our URL, trylgc.com/beauty, and be sure to use the code BEAUTY20 at checkout. That's trylgc.com/beauty and use the code BEAUTY20, beauty, BEATUY 20 at checkout. Get checked. It's the right thing to do.